Hi everybody, it's Dr. Schmetterer. I wanted to talk to you about some new information in the media these days that involves the concept that starting a lipid-lowering medication, such as a statin, at a very early age in the 20s or 30s is quite possibly the way to go. It turns out that the process of atherosclerosis, hardening of the arteries, plaque deposition inside the blood vessel wall, happens over 20, 30, 40, 50 years. A lot of times medicine fails to identify the significant buildup of plaque until something like a calcium scoring CAT scan shows bright white calcium inside the blood vessel. The problem with this is it's the tip of the iceberg, and there can be a lot of plaque that's inside the vessel that doesn't show up as bright white. Waiting for the calcium to show up is waiting too long. To be honest with you, the number one presenting sign of coronary artery disease, hardening of the arteries in the heart, is sudden death in more than 50% of people. And the reason people die suddenly from coronary disease is not because of calcified plaque. Calcified plaque narrows the vessel slowly over time. Collateral blood vessels develop to go around the blockages. Like if a highway shut down, people take the side roads, and over time, more side roads develop. These are collateral blood vessels. So a patient may experience chest tightness during heavy exercise. This represents an insufficient amount of blood flow being delivered to the heart muscle because of these narrowed arteries. But that's not what causes sudden death. Sudden death is caused by plaque that is soft plaque, that is vulnerable plaque that destabilizes and ruptures. This causes a sudden 100% blockage of the artery due to a clot, and this is what causes sudden death. You cannot identify this type of plaque on a calcium scoring scan. Now, there are sophisticated studies that can measure this type of plaque. Artificial intelligence quantitated CT scan, AIQ-CT, can be done. The studies have to be sent off to a place in California where these measurements are made. But the important thing to really keep in mind is that if there's any calcium at all in your coronary arteries, you already have coronary artery disease. And the only thing you can do, unless you have symptoms and a positive stress test, which requires treatment is stents or bypass surgery, unless you have symptoms on exertion, your question is what to do to stabilize the situation. And the answer is get those levels of bad cholesterol, the LDL, and the triglycerides not only under control, but drive them as low as possible. And this means aggressive lipid-lowering medications. A lot of people say, but I have muscle pains and aches with the statins. Well, there are a variety of medications that will lower your cholesterol without it being a statin and without causing the side effects. So you need to talk to your primary care physician, your internist, your cardiologist, and get those lipids under control and drive them as low as possible. Now, working hand in hand with the medications, as everyone knows, is diet and exercise. But these only do so much. Lowering your lipids over a long period of time, and we're talking from your 20s, will prevent the process that occurs over decades, resulting in blockage of the coronary arteries, and unfortunately, in more than half of the people, spontaneous rupture of a soft plaque. More on all of this later. Take-home message: if your lab's checked, if you are already in my decade, and it's not too late to be aggressive with lipid-lowering medications, which will stabilize and in many cases reduce the plaque,